This is a comprehensive review of a visual and tactile oral cancer screening, performed by Allison Stahl and narrated by Trish DeDios, Oral Cancer Foundation Regional Coordinators. Before beginning the exam, a review of the patient's medical history should be completed. Be sure to ask screening questions related to alcohol, tobacco use. Additionally, ask about signs and symptoms such as persistent ear pain, difficulty swallowing, persistent hoarseness, or change in voice. Before performing any palpation, a general visual exam of the patient's head, neck, face, and skin should be assessed for any variation of color, contour, consistency, or function. Variations of normal should be noted in great description and even measured with a probe if possible. Now have the patient lower their head forward so that the occipital nodes can be palpated. Then begin palpation of the submental and submandibular lymph nodes, being sure to press firmly against bony structures in order to feel any detectable or enlarged nodes. Perform a general palpation of the head and neck to detect palpable lymph nodes. If a lymph node is detected, it should be noted if it's hard, soft, movable, fixed, painless, or painful. Lymph nodes should move freely, and remember that it is the non-painful lymph nodes that could be a concern. Tender lymph nodes are usually related to infection the body is fighting. Throughout the exam, be sure to be comparing the right and left sides. Next, you will be checking the sublingual and submandibular glands by asking the patient to raise their tongue to the roof of their mouth while palpating. Next, ask the patient to clench, as this will allow the parotid glands to be easily palpated. Place your fingers on the TMJ and ask the patient to open and close. Check for any deviation upon opening and closing, crepitus, popping, or pain. Then examine the pre- and post-auricular nodes in front of and behind each ear using circular compression. Compare right and left sides. Now have the patient turn their head and lower their chin, as this helps protrude the sternocleidomastoid muscle for easy palpation. While in this position, also examine the anterior and posterior cervical chain of lymph nodes. Repeat on the other side. During this part of the exam, it is convenient to also palpate the supraclavicular nodes. Begin examination of the thyroid from behind the patient. As you gently palpate each side digitally, you slightly displace the trachea. Remember, there should be no nodules or masses. Some patients are already aware of nodules in this area and could already be under physician's watch. Move so that you can visually examine the thyroid area for enlargement. This is also a good time to examine the larynx for mobility. Asking the patient to swallow will cause the larynx to move up and down. This concludes the extraoral portion of the screening exam. Remember that if a lymph node is palpable or a gland is swollen for more than 2 weeks, appropriate referral should be considered. It's important to explain to the patient that they know their body best, and self-exams are encouraged in between dental recalls. You will now begin the intraoral exam. Examine the patient's lips and commissures. We are looking for any variation of normal in color, contour, and consistency. Examine the mandibular and maxillary labial mucosas and palpate each between the thumb and fingers. Salivary glands are normally detected, but they should be similar in size and pretty uniform. Check the color, contour, and consistency of the gingival tissues. Don't forget to check the frenums. It is common for the maxillary frenum to have a tissue tag. Retract the buccal mucosa and examine the tissue thoroughly. The buccal mucosa is a common area for variations of normal, such as lichen planus, occlusal trauma, linea alba, and other irritations. Palpate the buccal mucosa, thumb extraorally placed and fingers intraorally placed. Compare your assessment with the patient's other side. Hard and soft palate is examined along with retromolar pads and maxillary tuberosities. Retracting the tongue and having the patient say "ah" helps see the uvula and tonsillar area. Don't be alarmed by lymphoid nodules and aggregate that is often seen at the wall of the oropharynx. Inflammation in the back of the throat is common in patients that have postnasal drip or mouth breathe. The tongue and the floor of the mouth are high-risk areas for oral cancer. Have the patient stick out their tongue and use a gauze to thoroughly grip and inspect the dorsal and lateral borders of each side. Then the patient should lift their tongue to the roof of their mouth to examine the ventral side. The floor of the mouth should also be palpated. Don't forget to check Wharton's duct for any salivary stones or variations of normal. Complete examination of the tongue by fully palpating the tongue between your fingers. Parotid and sublingual glands can be easily activated by gentle stimulation. Assess the salivary flow. This concludes the oral cancer screening.